Aaron, I want to hear what you have to talk about today.
Yeah, healthcare. I wanted to talk about healthcare.
Healthcare. What is healthcare?
What is healthcare?
So, I wanted to.
And why do you want to talk about it? First of all, why do you want to talk about healthcare?
Because
that seems like the most boring thing we could talk about.
Yeah, no, I feel like a lot of people don't understand. They usually just go with what their company has. So, and a lot of companies have group insurances, which is okay, but there's, if you want to save on taxes, and there's a lot more efficient ways of getting a healthcare plan that's kind of managed by you, and it's like you're not going to be canceled or on your insurance.
So could you say it's sometimes better to not go with the insurance plan that your job offers?
Sometimes, yes. So I would like to point out that there are many different healthcare things. There's some FSA, HSA, HRA, and then I think there's one more.
HDHP?
What is that?
High deductible health plan?
That's
a type of
insurance that you could get. That's like a group insurance, I think.
Me, the normal person here, I just heard a bunch of letters.
Oh yeah.
Oh, show them our sponsor,
right.
Aaron. Show them
So
our sponsor.
this is our. I wish.
That little chart there.
Yeah, so I have a cheat sheet basically.
Our sponsor is Santitas. $2.20. They went up on the price, bro. They're $2.29.
That's add that 29 cents. I had inflation, you know.
So, I actually wanted to go into
So I feel like we shouldn't. I feel like we should just stick to those three. You know, let's not go too much in depth.
But
maybe for part two,
I want to actually focus on so what your healthcare plans that your TMC offers first.
Help John
Okay.
make the most out of his health.
That makes sense.
Yeah. So
even though he doesn't use it.
Yeah.
Even though I don't, and the
He
key
will have to use it one day.
We're very beginner, obviously, as all of our viewers know. We're very beginner, and this is coming from
This is the book. Oh God. This is the book. I'm getting all my information from basically. So there you go. Not stealing anyone.
Yeah. So real quick,
I'm basically just summarizing some of the stuff that's in this book. So
that's applicable to us, especially at this age.
So
it's important to know. I mean, the reason why I don't use my healthcare offered by TMC, the reason why either of you guys use any healthcares outside your parents?
No, not at the moment.
I believe it before. Is it 26 years of age is the cutoff?
Yeah,
it's 25 or 26 is when most healthcare plans define that individual as not a dependent, and a healthcare plan can effectively have any number of dependents on the plan. Mm-hmm. So for me, it doesn't make sense to go with TMC. I'm trying to remember. It might be United Health that TMC runs a lot of their healthcare through, but it's like $40 a paycheck, I think it was. So $80 biweekly that I'm saving by going with my parents. So it just makes sense.
Your parents are going to start to charge you soon.
Yeah, they could. It doesn't cost them a dime though. They were like, we don't mind if you want to stay on ours. I mean, there's no difference between 4 dependents, 5 dependents,
oh, really?
6, 7, 8, 9, 10. There's no difference.
Really?
And that's the crazy thing. And that's why my girlfriend, she is on her parents still.
I had no idea. So does it start with like one kid like as long all your children covered in a family plan?
Yeah, Aaron, I think they define it like spouse and dependents. And then it's just plural. And then it could be 1, 2, 3. It doesn't even matter.
Really?
But yeah, because I think they just do it all statistically. Like, okay, statistically, we need to make the deductible this amount. That'll cover everybody.
I guess like especially now when most families don't have more than 2 to 3 kids, it doesn't really affect.
I think even most of the viewers know like a topical understanding of what healthcare is. It's when you go to the doctor or when you get a blood test, you don't pay $2,000. You pay a deductible. So I think Aaron's really going to go into how you can leverage the account you have to not only afford that stuff in the meantime, but to prevent loss of equity over time. So FSA versus HSA. Yeah. One actually encourages wealth building. The other one
encourages roll over spending, and you can't roll it over. But
so what even is an FSA?
So FSA is a flexible spending account, and basically, is used for if you're working for a company and they offer this, that means you put money in before tax, so before it comes out of your income.
And that's like out of your paycheck.
Basically, yeah. So it's like FICA or any of those things. It just comes out tax free. But any money that doesn't get spent in that account at the end of the year, the employer gets. So it's beneficial for you to spend every single dime.
The employer gets that.
Yes. So it's important that you spend every single dime in that account before the end of the year.
I guess that incentivizes employers to give that out.
Yeah. So in a way.
What doesn't the employer also throw money into this account?
They can, yeah. So
yeah,
it's kind of like a sometimes they match it, and
I think that's what I was reading. Yeah.
Mm-hmm.
So then an HSA, you want to kind of go into a little bit.
So an HSA is only for certain healthcare plans that you have with your company. If you have a high deductible insurance plan,
can you have both?
No, it's like you have 2 insurance plans, so it's like, so what this guy in this book says that most people have group insurances, so that's what is under my parents. We have a group insurance thing. You have a group insurance. Your parents do.
Most families, right? Kind of have to, right?
Yeah,
it makes more sense.
And to be honest, it's good for those big ticket, health problems that people come up with. However, those smaller expenses, your high premiums, low premiums, that type thing. So the HSA can only be used for the high deductible, and what you can do with that is it's basically a FSA, but it rolls over. So you can put money in, all the savings, and you can take it out tax free for any like smaller, like, dentist office, dentist, any medical expenses that come up during the year. And you can take it out for completely tax free, but at the end of the year, it rolls over and acts as a IRA. So you can take it out.
I kind of want to go more into detail on that. Yeah. So it's like a savings account, right? Is it taken out just like in the FSA would, like out of your paycheck, like, right? But before you touch your paycheck?
Yes, it's completely tax free. So
and then you use that money to pay for the dental cleanings, checkups, physicals, all that type of stuff.
Yep. Completely tax free, and unlike an FSA, you can roll it.
But then, so what's the difference between like an HSA and like health insurance, like Cigna health insurance, or?
I think it's a big difference on the when I don't know about health insurance, like maybe just a HSA and FSA. If you think about it, FSA encourages frequent doctor visits. HSA encourages like rarely going to the doctor because you have a reason to like put it off. You have a reason to like, your money won't disappear at the end of the year. It rolls into the next year. And then that over time you can save, I believe you can save your medical receipts for any number of years up and beyond age 59 and a half. And you can save them all and choose to claim that tax break whenever you want. Yep. As long as you can prove the receipt. So like basically HSA is different from every other plan in the way it encourages.
So can you have health insurance and say whatever health insurance your job has and an HSA as well?
So usually an HSA is only allowed when you have a high deductible insurance plan, which is offered by your company that you work for or you own.
So basically. It's like the requirement.
Yeah. So you have to have a high deductible plan.
So they are in conjunction in that way.
Yeah.
You have the plan.
So you have the health insurance plan, and that whatever how much of that is taken out of your check every month, right? And then plus you will also take out money
to pay for the HSA, and that's, I'm reading on this forum, anywhere from $40 to $60.
So what you would use an HSA to pay for that premium, right? That you have the $50 that your physical costs and
Yeah.
stuff like that.
Yeah. So that type of stuff. Yeah, and the whole benefit is it's tax free. It's you don't have to spend it all, and then it acts as a retirement account afterwards. So
I'm reading it's almost identical to a 401k.
basically,
It's in every way as good as a 401k, in some ways better, but there's just no employer matching in an HSA. They don't actually be like, hey, 3% will match you dollar for dollar, and then they don't add to it.
So is it like invested into the stock market?
yes, you can invest it into stocks.
You could buy
mutual funds, things like that.
Could you? So I do know the one drawback to the HSA is that it's more localized than an FSA. So an FSA you can use to fund childcare. An HSA, that's a no.
Oh, really?
You
I didn't know
use
that,
it for
so.
medical expenses, but childcare falls into like the extraneous category.
Mhm.
So an FSA you definitely get, and I think that's the reason so many people use FSAs.
Yeah.
If anything, because they know they can peace of mind. Oh, sure, I lose the money at the end of the year, but I wasn't going to put in that much anyways. Plus,
Well, so what would you use that for? Like your children's food and like
dependent. It just said dependent care, so I'm guessing that could be categorized as babysitting. That could be categorized as
formula.
I'm not sure. It'd be great to have that guy here though to
Imagine
answer
Nate.
that.
Yeah.
The whole reason we're really interested about this, by the way, for the viewers, is we met this guy at one of the Jack's RIA Real Estate Investors Association meetings that was just absolutely like
On the dot.
like
knows
he
his stuff.
invented HSAs. Like he was
He
so
sounded like it.
knowledgeable.
That
He
basically
took
knew
something
everything.
so boring and he made it so
That's
interesting. And
true.
that's what we're kind of hoping to do here, because it's just so like there's so many 21-year-olds out there that just don't even know what healthcare is.
Yep.
I
So,
mean,
I want to point out, so group insurance, if you ever switch over, once you hit 26, you switch over to your own healthcare.
once John has his 5 kids.
for a while.
So you can either go with your group insurance at TMC or wherever you're working, or if you own your business, you can set up a high deductible insurance plan and then do an HSA on the side for all the putting away money basically. Yeah. So and then if you there's something called an HRA, which is
Health retirement account?
it's like a reimbursement account.
Health reimbursement account. Okay.
So
Yeah.
can you use that with either?
That's only if you have a business that. So basically, the way it works is you take out medical expenses, things like that, and usually it's only worth it if you have $4,000 in medical expenses for the year, and over. And basically, what happens is you do it, you take it out, and then on your business side of things, if you own your own LLC and things like that, then you can have it deductible. You're basically reimbursing your employee, which is you, and get a tax benefit.
Okay,
on
I
it.
want to go back to the HSA for a second.
Mhm.
So at the end of the year, you spend you have $1,000 in your HSA.
Mhm.
What would you do with that money? Well, what should you do?
If you have how
What
much in your
should you
HSA?
do? And you have no other medical.
So yeah,
expenses?
it's the end of the year. And yeah, like
And you've got $1,000.
I
in your
have
HSA.
$1,000 in my
You just
HSA.
You just do nothing. You
So
roll it over.
I'll just keep it, right?
Yep.
And then so I can invest that money, say in the S&P 500, right? VOO.
Yep.
And then
Things like that.
whenever I need that money, I can take it out.
Yeah. Let me
If you take it out for non-medical expenses.
Yeah. I meant for
Yeah.
for medical.
For medical expenses,
I can use it.
yeah, you can do that completely.
Can I? Do I have like a debit card or like is like a card?
See, I don't know. That probably depends on.
You don't know, Aaron?
An HSA card. There definitely is. There's a card
Right.
for that. I know that's what my parents were always talking about.
Yeah.
Mm.
All right, one of our viewers commented. He's not one of our viewers. One of the people on this Reddit that's very similar. This is worth reading. HSAs are good if you have spare money or rarely go to the doctor's office. Because
Mhm.
it's like if you have spare money anyways, might as well put it in the HSA.
So this guy says it's good for healthy people. It's,
Absolutely.
Especially like
It's-
young people, right? Like,
yeah, young, healthy people.
Right.
And he still says you want, the high deductible insurance. Those are for the big things, like
Yeah.
if you have like broken ankles or
Yeah.
like
Car
something
crash
like that.
or
Yeah,
something.
it's car crash, things like that. But basically,
So then
medical expenses you just do an HSA.
So talk about the transfer from HSA to IRA, transferring that. Isn't that
There's no transfer. It's an HSA forever. It just acts as a IRA when you reach retirement age, which is I think 59 and a half.
So if I'm like building up that money, say I'm the healthiest guy in the world, and I have $50,000 in my HSA when I am 59.5, I can take it out tax free.
Yeah, you can take it out as a retirement account basically. But I don't know why would you do that basically, because you want that money in case you go into like a nursing home or things like that.
Because then you could still take those receipts and then file them against the account.
Yeah.
And pay even less taxes. I mean,
so it's just one of those things.
But like the reason why nobody does it, or I'd say very few people do it, especially in a time like we're in, is you have to have spare money.
Yeah.
You have to have spare money. I mean, nobody's going to say like, if I have $1,000 laying around, why would you not put it in HSA? When in reality, people will put it towards their debts, or people will put it towards. I mean,
so if this is kind of like if you have money where you're not using, and you're like, you carry no maybe debt, my health is important,
right.
So then talk about the receipt part again. Like I'm buying cold medicine, cough drops, kind of stuff like that during allergy season, whatever. So then say I want to cash that out at the end of the year. How does that work exactly?
I'm not too sure, but
Aaron, you're supposed to know everything.
I have a feeling it's like the FSA.
So would you literally like send your receipts to?
Yes. So basically, you catalog all your receipts. You could probably, if they have
say I spend $500 on pharmaceutical supplies, right? What would I just get that? Would I get $500 into my HSA account? Is that how that?
So if you have $500 in
receipts, right? Yeah, expenses,
receipts, and if you have, I mean, like you have to have the money basically.
That deducts out of the HSA.
Yeah, that gets out of it's like an account. It's like a savings account. So
so you can take it out tax free.
Yeah.
So only if you can prove it's medical.
So if you have a debit card, it's like a debit card. So you swipe it, you do all that, but you have to save the receipts. Because your provider that does that will want to see a receipt for that, and any receipt that you don't submit, they're basically credit your bank account.
But why? So
you could theoretically go and buy a car out of the HSA, but if you get audited, and that's what it's saying right here, in the case of an IRS audit, you're going to want to have receipts to prove the distributions, proving they were used to pay or reimburse qualified medical expenses. So I'm sure 9 out of 10 people that don't get audited, they could go and just use whatever with their HSA, but that's why you want to keep your receipts.
But your HSA is probably monitored by a provider, so it might be very hard to go buy a car without them knowing about it.
So now I kind of understand.
Now you could do that, but you might get a penalty.
But like the medical supplies I was talking about. So you want to save your receipts because you would essentially get that money back, but it's also your money at the same time.
You don't get it back because you already spent it when you swipe your credit card, or your debit card at the doctor's office type thing.
Yeah, you're just proving
that it was an actual medical expense that you used it for, and if it wasn't, and they find out, they'll probably take the money out of your
Okay, I think my dad definitely uses that because that's why he always that makes sense because he always asks for the receipts after I go to.
Now he might have an FSA. I know my mom has an FSA, and
I think it might be an FSA.
And you have to do the same process.
The people we should really have on this podcast for some is our parents, right? Like
that'd be great.
That'd be awesome.
Who knows more about health insurance, us or our parents? Right?
I know my mom knows a lot about.
I mean her being in the medical field, right? Like,
what quick question for you, Aaron? What's the maximum amount I would be putting into my HSA every year to max it out?
I think it's like,
is it 5,500?
Guess I'm looking at the answer right
I
here.
think it's 5,500.
$6,000. Aaron's got
close.
it. Look at this guy. So basically, if you're going to be maxing out your 401k, you want to put in whatever that threshold is that your employer will match to.
I think it's the same as a Roth.
Okay, and then in the same way in HSA, you just want to get to that max threshold, so $6,000 a year.
Mm-hmm.
And then the big thing on reimbursement, Steven, is like, let's say I go and buy $500 worth of medical supplies, research chemicals, or whatever it is.
Mm-hmm.
I don't have to reimburse myself until I want to. And
why does that benefit?
Well, if
Yeah.
you leave the money in the account for longer, it can grow. for
Interest,
longer.
right?
So, and I mean, especially if you have it deployed in another vehicle in the meantime.
Oh, that's a good.
So
that's a good
reimbursing
idea,
yourself
actually.
is almost like cashing out on your stocks.
You just
earlier
you just,
on.
Interesting.
You just save all your receipts, and there you have
Exactly,
You
and that's
grow-
why you can
grow
do
like-
that on the day you die.
Say
you
your
can
receipts
literally
for 30
cash
years.
everything out on the day you die,
Yeah,
and
Wow.
then or whatever.
that'd be a pain in the ass for your
But you
family.
gotta
have-
save all that stuff.
I have my
Yeah.
receipt from 1965.
Just what percentage of people do you guys think max out their HSA, relatively stay out of debt in the first place, and also save the receipts?
0.
You're talking like
That's Dave
That's like-
Ramsey.
you're
that's like
talking Dave Ramsey,
Clark Howard.
That's
Clark Howard,
Dave Ramsey,
All of
Graham
those.
Stephan, and
You're talking so few people, so few people, and that's the whole reason they're able to offer an HSA in the first place. Is because
Yeah.
they know that.
Mhm.
That's funny.
the-
Oh,
So one of the things that is in
wow,
this
that's
book-
pretty interesting.
One of this thing, and it actually acts as a Roth IRA. You said it kind of acts as that 401k.
Oh, yeah.
Because it's
I was
tax-free.
comparing like
Yeah,
in the way
it's
of
tax-
401k, you want to max that out.
Yeah,
This,
but
you want to max that
it's
out.
kind of but
So-
it's taxed
You're right,
like
because
a
there's
Roth.
no yeah.
So I kind of want to go into what Nate was talking about. You like we said, you can use that money. You can put that money into stocks. You can also put it into real estate. Is that correct?
See, I don't know.
That's why we're talking.
Well, but
Yeah.
that isn't that the big thing that Nate said, right? Can't
Might
like
be, yeah.
can I use that? Because I mean, it's an asset, right?
if-
I think can you use that money for an investment property?
I'm sure if you somehow set up a self-directed HSA somehow,
What if it's not self-directed? What if it's employee HSA?
well then I don't know. It's
Could you put that money into a say maybe just a note or to your own investment program, which would be kind of hard, right? Because maybe it wouldn't work
it's not
because
liquid.
yeah, exactly. You can't really
Yeah.
you can't really
I mean,
cash
like,
that out.
If you wanna save it, I mean like John said, you can save all the receipts till later. So maybe when
But
you hit-
isn't that what Nate was talking about in the meeting? Like
Saving
you can,
receipts?
No, that you can use. I might be wrong. Maybe he was talking about IRA, but using HSAs to buy real estate, which I might be completely wrong.
I know you can do a Roth.
I know he was talking about. I know he
Maybe
was.
maybe it was the
401ks,
IRA. Maybe
IRAs.
it might have been transferring. You can transfer
I
your
mean,
HSA into your IRA. Is
If
that
you think
correct?
about it, HSA into an IRA.
Yeah,
No,
and then maybe
I don't-
Well, an HSA really acts as an IRA.
Yeah. So
That-
why would you switch it over
Basically,
to an IRA?
like Aaron, what do you think about this description? An HSA is a Roth IRA.
yeah,
It's just designated
just
for medical
designated
purposes.
but so
for-
I can have a Roth IRA and an HSA.
Yes.
And that's why people do that, because they can get
Yes.
$6,000 on the HSA, and then how much can they get on the Roth?
6.
So it's 6, and then you just doubled it, and then you have a wife, 6, 6, 6, and 6.
And then if you have a 401k with your
And so
company,
it's really just taking Uncle Sam out of more percentage of
That's
your
awesome.
paycheck.
Yeah.
That's what we want the viewers to
Oh,
understand. That's
shit.
really
Yeah.
it.
It's
That's
like,
really
that's
it.
really cool because like instead of just putting all your money in
And those
in
numbers
a-
may all be wrong.
if-
by the way.
in a regular stock market account, right?
Yeah.
And instead of just putting my money in Robinhood where it's going to be taxed,
Right.
if I use a Roth IRA, HSA, 401k, then
Yeah.
that money's going to be taxed.
Yeah.
Oh
I think
my
I read something the other day
God.
that like the people that are getting played right now are the teens and millennials that think they're investing, but
and
really
they're gambling.
they're doing it not only in gambling style, but they're not using any tax protective vehicles.
yeah.
They're getting slaughtered. Not only are they inexperienced, they have Uncle Sam
And
halfway in
that's-
with
the government's
they're
working
getting
on taxing it
slaughtered.
more right
So
now.
that's
right?
that's my problem with my stock account right now. I buy and sell like day to day type stuff.
Yeah.
So I'm gonna get hammered with tax at the end of it. So
Yeah.
I would love to see like
kind of-
your taxes at the end of the year.
I'm kind of looking. It's not gonna be much because I already have a low income tax.
Yeah.
So it's
but still, like the
basically
amount you
all-
profit, if you profit a few grand, right?
I
I
don't
think
think they're gonna
the
have to pay
standard
tax on that.
deduction is 8,000 for a single.
it's
So
okay.
if I make under 8K, it's
What
not,
if you make
it's not a
like
big deal.
50,000 this year?
If I make 50,000, I would be screaming out of my mind. As 50,000 on what I have, that would be basically tripling my money that's already in my.
And then he would
account.
gladly pay the taxes.
Yeah, I would. be
Uncle
like,
Sam.
Yep.
That's funny.
Yeah. So, anyways, the funny thing is that in this book it has, so Cobra. You guys know what that is?
Cobra.
No, what is it?
I have
I think
heard of this.
Nate talked about it for a second, didn't he?
Cobra is the most expensive healthcare plan, and it's for unemployed people. It's for when you're transitioning to another job.
Continuation of health coverage.
Yeah, and it's the most expensive temporary and.
Aaron, are you looking at the definition? Are you looking at the acronym of it right now?
What does it stand for?
Can you tell us what it stands for?
Nope.
All right. It stands for the Consolidated Omnibus Budget Reconciliation Act. Who knows? What does that even mean? What does that even mean? Here you go. Here's a snippet.
That makes no sense.
Snippet from the government, from our government's website.
Oh, nice.
COBRA generally requires that group health plans sponsored by employers with 20 or more employees in the prior year offer employees and their families the opportunity for a temporary extension of health coverage in certain instances where coverage under the plan would otherwise end. So it sounds exactly like guy got laid off. Mm-hmm. He's got to have some health coverage because he's got to pay for his glasses or whatever it is.
The day after he gets laid off, he gets in a car
Who's
crash.
Getting dinged for COBRA? Is it the employer? They're the ones paying out of their ass for a COBRA?
I'm not too sure. I think it's the person. They have to pay. It's like private insurance. It's like you got to pay to be in the program. So, and I think it's the most expensive.
So like
that's what this guy says,
I think we talked about this a little bit like in one of the first podcasts, but like being a real estate agent, I don't have any.
Exactly. That's why I'm talking about this.
Aaron, what do I do?
So what you could do is you could go look up a private healthcare insurer.
Our good friend Paul Ashley.
And you can pay a really low price for the high deductible.
You think
insurance.
so?
Because you're young, right?
You're young, and I'm pretty
healthy.
Pretty sure a high deductible insurance is cheaper than a group insurance plan. So that's like.
Oh, it makes sense.
Yeah.
One person instead of.
And then
John's 5 kids.
You get that, and then any savings left over that you want to put in, you basically put in that HSA for,
So I can have an HSA
stuff.
if I'm not a W-2 employee.
Yes, and that's what's so great about it is that it's a way out for people that don't want to spend too much money on their group insurance plan for their.
Maybe the group they're stuck with at work is just shitty.
Exactly. Yeah, maybe they don't offer that many benefits, so you can quit them and then go hire or go get a private insurance.
So Roth IRA, Roth IRA, it's HSA and 401k. What order should you pay max amount?
Actually, I don't.
Aaron, where's your research?
If you were saving something,
what
I would actually put it into the HSA first, and then a Roth.
So a lot of people, I think we just said this, but some people just use an HSA not as a health plan, but just to save money.
Yeah. I think the reason Aaron, to your thought, I would completely agree with that, because if you think about it,
if you're
put
healthy
it into the Roth, or even if, like, let's say theoretically you think a health incident might pop up, but you have all your money tied up into the Roth, the HSA would still afford you the option to
pull it out,
disperse out of it.
Yeah,
a Roth. I mean,
can you look up the penalty for taking out money from an HSA for non-medical expenses? Because you might get a penalty, you might get a tax. That money that you put in.
Dang, yeah.
The gain, you might get taxed.
So
on,
yeah, so it would 100% make sense to max out your HSA first.
Yeah,
because you have like you in some instances you can take it out tax free.
Yeah. So, and medical expenses. Medical expenses are probably the most important that you would want to save on. So
100%.
And it already acts as a Roth later on down the road.
That's crazy.
If you want to. What's the penalty?
Guess your penalty.
10%.
20%.
20%.
20%.
But if you think about it,
it might be worth it.
That's actually still worth it, because you're avoiding 15 to 20% in taxes when you put them in.
Yeah. Is there any
because let's think about it. If I make $100, if I choose to get that from my paycheck right now, I'm going to get $82. If I choose to put it in the HSA, it's $100. If I take it out early, they're going to fine me 20%, so I'm going to get $80. So it's either 82 or 80.
How are we not taught this in high school?
Check and see if that penalty includes
after 65.
No, includes income tax. You might still have to pay income tax on that.
Let's see.
So they might
plus
take
like 20% plus income.
and that's how it is with the Roth. So
really, I didn't know that.
Yeah, so it's 10% plus any additional income tax. So that's the penalty. Now, granted, I think Nate said something.
You called it, Aaron. Unfortunately, the bad news does not stop here. In addition to the 20% penalty, so it is worse. It is worse to do it this way.
Yeah.
The IRS will also consider any HSA funds spent on non-qualified expenses as taxable income. You've just gotten that 20% tax was added on to
whatever your tax bracket is.
So if you cannot afford an HSA, do not buy an HSA.
Yeah.
That's if you cannot afford.
Don't buy a car with your HSA.
If you are in massive debt and cannot afford your next medical emergency, an HSA might seem like it's a shield, but you're actually just going to get taxed even more. Because if you have to crack into it, I mean,
100%.
For non-medical purposes.
However, now would it be worth it if you're already putting money aside for a Roth, and all the pieces line up for an HSA that you can get?
HSA.
I'll go for an HSA because
Dang, John,
it acts as an IRA.
Right now, you should be putting. So do you have an HSA, John?
No.
So can you get one through TMC?
No,
though?
if he's on his.
So you have with your parents. If you're on your parents' plan, you can't do it.
Well, it's probably the plan holders.
It's the plan holder. It's like
I feel like our parents should listen to this podcast.
I have a group can correct us on this.
Yeah.
And Steven, to answer your question, I do not have an HSA
because because
I know that I would be incurring a $40 to $60 fee every year just to keep it open, and I don't pay that.
There's a fee just to keep it open.
There's a fee to keep it open. Yeah,
interesting.
I didn't know about that.
$40 to $60. Yeah. Okay, per Reddit.
I feel like it's per health. Like I feel different companies, right? What it costs.
I think there's an administrative fee for like every place though.
Makes sense.
But
probably makes sense.
There's always administrative,
and that's money that's going directly to.
However, if you have enough in there that you make $400 in a year just based on gain in the stock market, then
that's crazy.
I don't know, it might be.
I think the biggest one of the major advantages is just unlike the FSA, an HSA rolls with you from job to job.
Yeah.
It's a retirement vehicle. An HSA is a pile of cash that's designated primarily for medical expenses. You can use it for other expenses. You're just going to pay a fine. And by the way, it's not taxed.
Wait, so then what's like the benefit of an FSA?
FSA allows you to spend.
It's still tax free. I mean, like if you have a group insurance, like a huge insurance.
So is an FSA can't be invested?
How would you go about that? I don't know. An FSA I know cuts off at think about this. An FSA is $2,750 is the cap.
Yeah.
And it rolls over and it does not roll over.
And it doesn't.
So whether it's invested or not, $2,750, I mean that's almost nothing.
Yeah.
So I don't think it is invested. I don't think it is.
And money in your FSA, it's tax free.
It's tax free.
But money in your FSA it has to go to health like medical expenses. Right?
Well, and it can go to some other stuff too, but I know there's like 5 categories.
You said the child.
There's the ones stuff, that are. Right? Yeah, let me actually get that for you guys. FSA.
Yeah. So there might be more options available with the FSA. So I mean, like if you're making bank at your W-2 job and they offer a high deductible, and somehow they offer both FSA and HSA, do them both.
You got three main
I don't know
types.
How that would work, but.
There's a couple other types, but there's 3 main ones. Health FSA is number 1. This is the most common. It's also known as a medical FSA. It allows employees to use pre-tax dollars for out-of-pocket medical expenses. 2, dependent care FSA. Allows employees to pay for employment-related dependent care services on a pre-tax basis. And the max annual contribution for this one is $5,000. Okay, but it doesn't roll over still. 3, adoption FSA. It's the lesser known of the 3, and employees can set aside pre-tax money to use on expenses incurred while adopting a child. So you could be running a adoption FSA simultaneously with the other FSAs.
You have more than one FSA. You can have more than one FSA.
Aaron, do you think that's correct? Because why would you ever have a adoption FSA just for
adoption?
You want to adopt?
Is that really that important?
An adopted child.
It costs so much to adopt. It costs so much, right?
It probably costs a lot.
But that's just in the process of while you're adopting a child. I don't know. That's interesting.
I thought it meant you could. Those are all one FSA that you can use. You can use your FSA for all those things. Is that correct? Or
I think those are 3 types of FSAs.
Really?
Huh. 3 types of flexible spending accounts. So I think the designations.
there's a whole. Maybe I should have read this book. This book goes into more details about maybe like a business side of healthcare. So if you're own a business,
I should have listened to Nate's podcast before.
Maybe but it's pretty interesting. So if you're
I didn't realize it was gonna be this interesting.
Yeah,
I think
basically
because it is pretty cool that
yourself. Yeah,
because I think Roth IRA.
So this guy has it. There's 5 different types of insurance plans. So there's Cobra you could do, and then a big company group insurance, which is what my mom,
most people have.
Parents have is basically what
most families have. Most families
have because but it's the second most expensive. First is Cobra. Second most expensive is the big group insurance, which probably makes the most money for whoever's offering it because
I bet.
It's not really favored for healthy people like us, like young people.
Most people in America, fast food every day.
Yeah. So, and then comes the independent individual insurance, which is a low deductible. You can't really do an HSA, and that's the third most expensive. And then they have
what's the other two?
The high deductible one, the high deductible company insurance, company group insurance, which is a benefit, but it's fourth most expensive and allows for an HSA, and then a high deductible independent individual insurance, which that's like the dream when you get that because
what is that?
So it's most affordable. It allows for HSA, and it's kind of like if you own your own LLC or corporation. There's certain ways to set it up, like tax strategies, but it's people who have their own business and they set up an individual high deductible insurance plan for themselves, and then they have the HSA on the side. Yeah, but you could like buy into it. Private high deductible insurance plan.
Guys, let's make our own insurance company.
Basically, the savings on that would benefit you basically more than a group insurance if you're a healthy person. So
hold on, wait a minute.
So if you're not healthy, you said that third one was the best one.
If you're like,
or say you just have medical problems,
if you have medical, you were like born high medical expenses, if you have prescriptions or like, since you're a kid, basically, maybe a big company group insurance might be the best. So yeah, but I mean, like, if you have a high deductible company group insurance, that's still a win-win.
So then, what's the difference? Okay, so say I don't want to use any of those, and I want to use government funded, say like Obamacare. I don't make that much money. I'm past 26, and I just want the cheapest thing possible.
So I'm not sure how Obamacare works, or Medicare. But isn't Medicare like after you're retired?
Yeah, 65, right?
Medicare is government insurance.
Yeah, government insurance. Now I'm under the impression it's like, why would you rely on something that might not be around?
Because
government insurance,
because you can't afford it. Because you can't afford regular. You can't afford that that $40 taken out of your paycheck, right? Like if you really
isn't that pretty
thing? I mean,
and no, and it's 100%. Like there's a lot of people like working at Publix, working minimum wage jobs, right, to support a family, and that $40, that $80, that's a week's meal, weeks of groceries. So yeah, that's kind of the biggest. That's why so many people are on.
But I would never count on it. I have to jump backwards. So you know how we were comparing a Roth IRA and a HSA?
Yes.
An HSA entirely destroys the Roth IRA because the Roth IRA, I mistakenly forgot, and I should know this because I have a Roth IRA.
Can you not put in?
You can put them into both. You can max them both out. But the Roth IRA, you pay taxes putting the money into it.
Yeah.
I don't know why I did not remember this. But the HSA, you never pay taxes in any of it.
Yeah.
As long as you take it out after 65. So
you're saying that HSA completely destroys in tax savings rather than a Roth. So HSA is better.
I don't even see why you'd ever want if you could only afford less than 6K total. Why would you ever want a Roth IRA if you know you're not going to touch the money?
Yeah.
Because a Roth's going to penalize you too, taking the money out early. Let's see what their penalty is.
It's 10%.
HSA,
I can tell you, it's 10% and it's taxed as ordinary income.
So that's better than the 20% tax.
It's better.
The HSA is weighted against it. So
if you take it out,
really sure you're not going to take that money out of the HSA.
Yeah. So
okay.
And granted, it doesn't have to be $6,000 to put it in. If you put in, I don't know, 1,000, that's probably most. That's enough to cover most like premiums and things like that for medical expenses.
HSA is bulletproof, really. You don't pay taxes going into it.
As long as
you don't pay taxes coming out of it. If you need the money during, make sure it's medical and make sure you have a receipt. And also, you can't buy real estate with your HSA.
Okay, there you
got it.
Which is why none of us are getting that. Well, let me clarify that.
I don't think you can buy it.
If you could, then nobody would have a Roth IRA. Let's face it,
exactly.
Nobody would have one.
Yeah, it would be
medical property.
Let's see. Now, granted, HSA is hard to get into if you don't have the insurance plan. It has to be a high deductible insurance plan. So,
I feel like there's like a lot of reasons why people don't have an HSA, right? They rather can't afford it. They can't afford to put money in it. Too young.
The low deductible.
Don't have the right
can you?
plan.
While HSA plans do allow alternative asset investments like real estate. Hold on.
See, that's what Nate was talking about.
How to invest in... Let's open up this article real quick.
Told you guys, I'm smarter than both of you.
That's pretty cool, actually, if that's true.
Hold on.
That's what Nate... That was like all Nate's
Is there something
thing.
called...
Was it... This is probably not true, too, but wasn't he... Yeah, I'm pretty sure that's like his big thing, was talking about how he can fund... Which is kind of crazy.
What?
Gosh. Wow. There you go. That's all. That's all you need to do.
It's talking about a 1031 exchange.
Like, why?
Wait. Why would it be talking about that?
A 1031 exchange
and an HSA?
Allows you to invest in real estate and defer taxes when you sell the property, even without using a savings or retirement account, like a self-directed IRA, HSA, or solo 401k. Okay, it's kind of just explaining what it is.
Well,
can you 1031 exchange into an HSA?
No way. No, because it has to be it's real estate to real estate.
1031 exchange. No, it's qualified. It's not actually real estate to real estate.
No way.
It's qualified accounts. It's qualified
Hold
investment.
On, this article's
investment accounts. I'm pretty sure. But real estate is the most popular one because
all
the other ones, I think.
But what's my other option?
Well, let's look it up, but I'm not too sure about the other ones. But I know it's like an investment vehicle. Okay. So it's you can put it into.
So if I sell my investment property, I make 50 grand on it by selling it. I hate real estate now. Where else can I put that money? To not have to pay the taxes.
Okay.
In a trust that's primarily reaching into stocks, maybe. I don't know. I do know that if you buy out of either a Roth or out of an HSA, we're just learning this, that you can buy real estate. Well, I guess Steven already knew this. Yeah, you can buy real estate from an HSA, but if you are found purchasing real estate from an HSA that one of your relatives or you yourself is living in, you're going to get audited.
Yeah, because it's not like
because then you're benefiting yourself and avoiding that 20% too. And that's what it is. And so if you basically buy rental property with your HSA and the IRS finds out that you bought that rental property just so you could live in it, or your family or an immediate person lives in it, you're going to get heavily fined. In the same way, if you make $1,000 a month off this rental property that you purchased out of your massive HSA, and you put that money into your wallet, you're also going to get fined.
Really?
So you can't that money flow? Needs to go into a trust company like Strata, or it needs to go somewhere else that's still not in your name. And then from there, they can put the money into your Roth IRA, into your company. It can go wherever, but if it touches your wallet, that's when it starts. That's when Uncle Sam gets involved. But I didn't know HSA. How in the world does an HSA buy real estate if it's
I remember Nate talking
directed?
about that. That's the whole reason Nate was there, right? Like in our real estate event.
Okay, I think we left off with us in shock that you could buy real estate, but since then we've clarified that it does make sense, because in the same way you can put your HSA into stocks in the meantime, you can put it into real estate. So Steven, have to give you credit there. You were listening during the
guys.
Jack's
What
Rio
were you
meeting.
guys doing during the Jack's Rio meeting, guys?
Trying to win the raffle. I don't know.
That was a pretty.
Yeah.
I don't know. The raffle was pretty high. But anyways,
So Steven was just talking about how, like, let's say you're in a scenario where you have an HSA and you need to make a medical visit. Well, having an HSA kind of implies you have a high deductible health plan. And
wait, so what is a deductible?
A deductible, yeah, good question. So a deductible, I think I have a firm enough understanding for. It's just a set amount of money, like car deductible for car insurance. If you get in a $3,000 accident, your deductible is $2,000. You're gonna pay for the first $2,000 of that accident, and then they're gonna come in and pay.
Your
for the last
deductible is what you pay.
Exactly. Yeah. Now for high deductible health plans,
and what's a premium?
A premium is the amount you pay per month or per year.
Per month
That you pay for that access.
$40 premium. That's what I'm paying.
But for like a $5,000, I think we were just watching Dave Ramsey. A $5,000 deductible, like for a car accident, it's on a per accident basis. For a health plan, it's on the total year. So $5,000 plan means that for the first $5,000 of medical expenses in that year, that could be maybe, I don't know, a total of 8 doctor's visits, 7 dentist visits, and 6 of whatever else. After you get to $5,000, if you're like 8 months throughout the year, your next 4 months are pretty much, they're paying for everything.
For everything?
That's, to what I understand, that's pretty much how it works.
Oh, so there's a limit how much
So-
you can
So
take
there's
out.
So that's when you want to
to.
start fights and like.
That's when you want
people-
to, let's say
Dude.
braces. All of your kids are getting braces. I don't know if braces are covered on every plan, because that's kind of like a luxury category, I think. But
Yeah.
Or
no,
like
that's how the deductible
if
works.
and any like minor surgery, like if your kids need their tonsils pulled out or something like that, maybe.
Maybe something like that. Or let's say you're having a baby. I have a coworker.
That's what
Who
you wanna
has
have.
I have a coworker who's having a baby right now, and she's already met her deductible.
So have a baby after you need the
So yeah,
plan that out.
Oh, I thought my mic was turned off.
No, you're good. Don't worry.
But,
I got you.
Yeah, that's just how a deductible works. It's and it makes sense. Like Steven, doesn't it make sense how if you have a higher deductible, you're gonna have a lower premium, because
Yeah, that's
statistically,
what I was telling Aaron.
You're right. You're gonna be paying more out of pocket.
So is it better to have a higher? It's better to have a higher deductible, right? Because you might
That's
not
if you're
need to go to the
healthy.
doctor,
That's what I'm
right?
saying.
If you're healthy.
If you're healthy, you don't.
Yeah.
Maybe you go to the doctor maybe like once a year.
Right.
Maybe twice a year, maybe.
Or just
But-
okay.
Yeah, so all of that.
You
And
gotta
then-
be going
and then when you're 59, I have a feeling this is why they did it like a IRA. Then you can take it out like a retirement account and actually pay for medical expenses.
Absolutely.
Or anything, right? You can use it for anything.
Anything.
not-
So, and that's probably why
That's
they did that.
insane.
So,
That's awesome.
it's kind of like a win-win if you can get it and you're healthy.
So
you don't pay
John-
more than
John,
5,000 in
what you have to
medical
do
expenses.
is never get sick, and then instead of going to your doctor for a physical, you go to plasma for your physical. Or they do it for free.
Absolutely.
You get paid to get a physical.
Get paid for the physical and the saline and all that stuff.